The Medical Patient Assessment and Management Station is designed to test an EMT candidate's ability to systematically examine a patient with a medical complaint and to appropriately manage the conditions found. Candidates can assume there are up to 2 assisting EMTs that will carry out verbal treatments requested. This station should take approximately 10 minutes to complete.
You'll want to conduct your medical assessment as you would in the field. Communicate with your partner as you conduct this assessment in a systematic manner. State what you're assessing and what care you're providing as you perform the skills so that the examiner can see and hear what you're doing. Use the mnemonic sample to collect important information about the patient's medical history.
Candidates at this station will have equipment and supplies necessary to assess and manage a patient with simulated acute illnesses. The medical patient will be moulaged as necessary to help depict the desired condition, such as diaphoresis or pale skin. Equipment and supplies for assessing the medical patient can include a house kit with stethoscope and BP cuff, and medical exam gloves as part of the necessary personal protective equipment. Equipment and supplies for treating the patient's condition may include items such as supplemental oxygen, nitroglycerin, or a bronchial inhaler. The main sections of the Medical Patient Assessment and Management Station involve BSI precautions and scene size-up, initial assessment, focused history and physical exam or rapid medical assessment, ongoing assessment, and managing the patient's medical condition appropriately.
Hello gentlemen, welcome to the testing station for the medical scenario. You are being dispatched to an unknown medical problem at a private residence. This is a 50-year-old male. Since you've already examined your equipment, do you have any questions before you begin?
No, ma'am.
Okay.
Begin the station by indicating that the proper personal protective equipment is being used. Size up the scene to determine that it is safe to gather other information about the incident and to consider the need for any additional protection or resources.
Okay, we're going to take proper body substance isolation, assess the scene for safety. Is the scene safe?
Yes, it is.
Number of patients?
Just one. He's by himself.
Okay.
Once at the patient's side, determine the patient's chief complaint and use the initial assessment to identify and manage any immediate life threats. These include the ABCs, airway, breathing, and circulation, and any immediate interventions necessary for the patient's condition, such as the administration of oxygen.
Approach the victim. Hello, sir. My name is John. How are you today?
Okay.
What seems to be the problem?
Chest pain.
Okay. Patient is conscious and talking to us. He does have an airway. He's complaining of chest pain. That's an advanced life support complaint, so we're going to request advanced life support assistance. At this time, because of his chest pain, direct Chuck to establish oxygen by non-rebreather mask, and I'm going to assess his circulation very quickly. He does have a pulse, and we noticed that he is rather diaphoretic.
With the initial assessment complete, perform the focused history and physical exam for this conscious patient. This phase of the assessment includes establishing a baseline set of vital signs, interviewing the patient, and investigating any problem areas identified as part of the initial assessment and focused history. Use the mnemonic SAMPLE to gather important information about the patient's history. SAMPLE stands for signs and symptoms the patient is experiencing, allergies, particularly to medications, medications including prescription and over-the-counter medications, past medical history, particularly involving similar episodes in the past, last oral intake including food and beverages, and events leading up to this problem.
Chuck, as soon as you get the oxygen in place, will you please take a baseline set of vital signs? You have chest pain. Is there anything else that's bothering you today?
No.
Okay. Are you allergic to any medicines?
No.
Are you allergic to anything at all?
No.
Do you take medicines regularly?
Yes.
What do you take?
Sir, I'm going to give you some oxygen. Just breathe normal for me.
Nitrostat.
You take nitrostat. Do you have that? Have you taken this recently? When was the last time you took the nitrostat?
Just before I called you.
Prior to taking the nitrostat, on a scale of 0 to 10, 0 is no pain and 10 is the worst pain you've ever felt. How would you rate the pain?
8.
And after you took the medicine?
About a 6.
Do you have any other prior medical problems?
No.
When was the last time you had anything to eat?
Breakfast about 4 hours.
You had breakfast 4 hours ago. Okay, what were you doing when this chest pain started?
Watching TV.
Okay. So you haven't been hit or had any other injuries or anything that led up to this chest pain?
No.
Okay. If you would, Chuck, also please get a set of vital signs. The patient has given us a bottle of nitrostat. It is 0.4 milligrams. It is prescribed for him, and it has not expired. Have you taken Viagra within the last 24 hours?
No.
All right.
As part of the focused history and physical exam, the rescuers should evaluate any pain the victim describes by using the letters OPQRST. These letters stand for onset, which refers to the point the problem first started. Provoking factors, which refers to anything that seems to bring on the problem or make it better or worse. Quality, which refers to a description of the pain, such as sharp, dull, stabbing, or squeezing. Radiation, which refers to any additional areas where the pain may be present, such as chest pain that radiates into the shoulder or jaw. Severity, which refers to a pain scale typically 1 to 10, with 1 being normal and 10 being the worst pain imaginable. And time, which refers to items such as whether the pain has been constant or intermittent, and if it has occurred on other occasions. With information gathered and a closer inspection of any affected area conducted, the rescuer should verbalize and perform any appropriate treatment for the patient. This would include obtaining medical direction as needed, making patient transport decisions, and conducting a detailed physical exam if warranted.
As soon as Chuck is finished with his vital signs, if they meet the standing order criteria, we can, since he is having chest pain, by standing order, we can assist him in taking 1 more nitrostat, 0.4 milligrams sublingually. Now that you've had the oxygen on, how's your chest pain feeling now?
A little bit better, but I'm just more relaxed.
Okay.
Blood pressure's 136/84. Pulse rate's 84. Respirations are 18.
Is that correct for the scenario?
Yes, it is.
Okay. His vital signs do meet the criteria for administering a nitrostat, so we're going to do that. We've already inspected the bottle. We'll give 1 tablet, give that to the patient. Where the patient has not taken Viagra within the last 24 hours, so we're going to give 1 tablet. Okay. If you would place this under your tongue, do not swallow it, do not chew it, just let it dissolve. Okay, he is going to dissolve the nitroglycerin. Within a minute or two, we're going to reassess him, ABCs, his level of consciousness, and his pain. We will also reassess his vital signs, and we will continue to do repeat vital signs every 5 minutes. At this time, we would also start making preparations for transport and also contact medical control for further directions and to notify the hospital.
With the main portions of the assessment and management complete, the rescuer needs to conduct an ongoing assessment during transport. The ongoing assessment enables the rescuer to repeat the initial assessment, vital signs, and focused assessment regarding the patient complaint. It also enables the rescuer to check to see how the interventions performed so far are working.
If the ALS unit is not within a reasonable distance, we would transport potentially to meet them en route if it's appropriate, and we're going to contact medical control, along with the reassessment that will continue until we reach the hospital. At that point, we have completed the scenario.
Okay, anything else you'd like to add?
That is it.
Okay, thank you very much.
With the scenario complete, the examiner checks the candidate's performance against the critical criteria for the station. The items at this station that would result in failure include failing to take or verbalize the use of body substance isolation precautions, failing to determine scene safety before approaching the patient, failing to obtain medical direction or to verbalize standing orders for medical interventions, failing to provide a high concentration of oxygen, failing to find or manage problems associated with the airway, breathing, hemorrhage, or shock, failing to differentiate the need for transport from the need for continued assessment at the scene, failing to assess the airway, breathing, and circulation before performing a detailed physical examination, failing to ask questions about the present illness, and administering a dangerous or inappropriate intervention.
Remember to verbalize scene safety in BSI. Take your time and walk through sample, step by step. Remember that oxygen should come before any medication. And if you find a life-threatening problem, fix it right away.